the thought of having surgery was, really hard for me to get my head around and decide to go do it. But the sleeping, you couldn't sleep and you uncomfortable and couldn't go do the physical things that I like to do.
I was very afraid to have back surgery. I think that's why I spent the 4 days when I couldn't walk because of my leg, I spent really researching the difference between the neurosurgeon and the orthopedic surgeon and Dr. Tang, and I read everything I could about him so that my fears were dissipated.
My back was getting worse. That's why this past year was so bad, because it was getting qualitatively and quantitatively worse. And it didn't have to even come to that, because I could have had this surgery a year ago or 2 years ago.
I think that surgery for anybody is scary for several reasons. I think that first, just having general anesthesia and being unconscious, having that lack of control of what's going to happen, and that uncertainty causes most people a tremendous amount of anxiety. And I think that also many patients fear surgery because they can conceptualize it better than they can conceptualize their future. So for example, patients may have a risk of becoming paralyzed, and yet they're not afraid of the paralysis as much because it's in the future and they can't see it. They're not as afraid of that as they are of the surgery itself. But in the situation where you're comparing possible paralysis versus surgery, the reality is that the safer choice is the surgery. I think that that's the part that's oftentimes difficult for people to accept, is that we oftentimes think that surgery is the dangerous choice, when in fact sometimes surgery is actually the safer of the two choices.